All right, good afternoon, everyone. Thank you again so much for joining us for today's webinar about the relationship between what we eat and how we feel. My name is Marissa Frieder. I'm the Senior Project Manager for WorkWell NYC, and I'll be moderating today's webinar. We're very fortunate to be joined by Dr. Melissa Lee from New York City Health and Hospitals, and she's going to be telling us about how what we eat affects how we feel, and she'll share some tips on eating to be well, both physically and mentally. And before I turn it over to Dr. Lee, I just want to share a little bit about WorkWell NYC, who we are, and what we do. WorkWell NYC, we are the city's worksite wellness program, and we're here to help you live well and work well. Our goal is to create workplaces that help employees live healthy and active lifestyles, and to provide health and well-being services, programs, and resources at the worksite and beyond. And our goal is to make it easier for you to be healthier, whatever that means to you. We know that health is not just not being sick. It's physical and it's mental, it's emotional, and it exists on a spectrum. And so WorkWell NYC aims to be here for you, no matter where you are on your journey, to help you move more, eat well, be well, and take action to prevent disease and stay healthy. So today's webinar is one of several that we're hosting this year on various topics that will help you hopefully work well and live well and be well. Today's webinar is exciting. It's a crossover between our Mental Health Be Well series and our nutrition program. But we have many more exciting webinars coming up, and you can find more information about these on our website. We'll also be sharing the registration links for these upcoming webinars following today's presentation. But for now, we're here to talk about how food affects both our minds and our bodies. And with that, I'm going to turn it over to Dr. Melissa Lee, who is the Director of Adult Primary Care at Kings County Hospital. She is both an internist and a pediatrician, and she has some really great insight to share with us from her medical lens, as well as being a city employee herself. So I'm going to turn it over to Dr. Lee in just a second.
Okay, thanks so much to the team at WorkWell NYC for giving me the opportunity to give this talk, to Marissa and Afia, and also Sakara and Victoria for making this presentation look so great today. So as Marissa mentioned, I'm giving this talk from the perspective of a physician. I practice internal medicine and pediatrics at Kings County, and also as a parent. I have 3 kids in the New York City public school system who are probably eating food courtesy of the Department of Education right now in school food, and also as a New Yorker, because we all battle the environmental triggers and pressures that accompany our fast-paced, no time like the present life that we live day in and day out. I also was reminded by one of my colleagues to give a shout out to all of the registered dietitians out there. We work with some amazing RDs at Kings County, and today is National Registered Dietitian Day. So I'm going to start off with a quote from Hippocrates, let food be thy medicine and medicine be thy food. We're going to just kind of keep this in mind as we go through the talk, and hopefully you'll find different ways to see how this may resonate with you. So our objectives today are to discuss eating well to live well, to learn about the relationship between food and mood, and to share some tips about how to eat mindfully. This talk is not a discussion about the latest diet trends, a list of healthy recipes, or a plan for weight loss. And so the first part we'll discuss is eating well to live well. So what is wellness? Wellness is defined as the state of being in good health, especially as an actively pursued goal. So it's an active process of becoming aware of and really making choices towards living a healthy and fulfilling life. So if we define wellness as an active process of making choices towards being healthy, then how can food help us reach our goals? So food is fuel. We need to develop a positive relationship with fuel. What kind of gas do we put in our car? What kind of food do you put into your body? Food fuels us to move, work, play, think, and learn. It also provides us with energy. So this is the energy that we need to survive, the energy for growth and development. That's in kids as well as in adults. The food gives us the building blocks we need to grow cells and muscles and survive. It also helps us with recovery. So if you're recovering from a hard workout, you need water, you need protein, carbohydrates, all of those wonderful things to help those muscles regain strength and be ready for the next day. We also talk about food as prevention. So would you like to prevent constipation? As physicians, we recommend lots of water and lots of fiber intake. Want to avoid high cholesterol? We talk about focusing on a heart healthy diet. And food can also be medicine. So the food choices we make affect our body. And for those who might have had any heartburn symptoms in the past, you might have talked to your doctor about avoiding spicy or acidic foods or staying away from caffeine. For those living with diabetes or high blood pressure, dietary choices like limiting salt and processed sugars could have an impact on our blood sugars and our blood pressure readings. So we can agree that we need food to live, but something that we should also think about is that not everybody has access to food. So we talk about food insecurity. Food security means that all people would have access at all times to enough food to live an active and healthy life. But that's really not the case in our country. In fact, looking at New York State, 12% of residents have some food insecurity, and 1.2 million New Yorkers, or about 15% of our population, have food insecurity. And that's a huge impact on our community. So over 1.4 million New Yorkers rely on emergency food programs annually, and 20% of New York City children and seniors use soup kitchens and food pantries to get the food that they need. What's the cost? Well, poor physical and intellectual development. Teachers will tell you that they know which kids are hungry at school. And also the cost that I see in our practice of chronic illness. So diabetes, heart disease, high blood pressure, and other illnesses. On the other hand, we also suffer from a surplus of foods. And often the foods that are more available and accessible and cost less also have lower nutritional value and are in fact higher in calories. So this has really led to a nationwide obesity epidemic. You can see here, this is some data from 2015 to 2016 from the CDC, and 40% of adults and 19% of children and adolescents are obese. That has a huge impact to living healthily and on medical problems in the US. So related to heart disease, stroke, type 2 diabetes, high blood pressure, and others, has a big cost to our healthcare system. So it's estimated that this costs us about $147 billion annually. And compared to peers with a normal weight, the healthcare cost for individuals who are obese is significantly higher. So why do we keep eating? Well, we're addicted to food. We eat a Western diet that has a surplus of food, sodas, fast food, and very palatable food rich in fats and sugars. Food gives us rewarding effects, so food can often lead to positive emotions, which cause overeating. Palatable foods can actually engage the brain and signal reward pathways that are similar to what drugs of abuse trigger and make people keep coming back. In addition, our society is addicted to food. So as a result, we overconsume. This was a picture of a Shack Burger advertisement. If you go into the new and improved LaGuardia Airport, you'll see and you'll be greeted by Shack Burger. It's the first thing that my kids were gravitated towards going. And yes, they had a cheeseburger and a shake. So now's your chance to get involved here. So we're going to talk about the relationship between food and mood. And I'd like to take a moment to ask what everyone had for breakfast this morning. So we're going to have a poll everywhere. And you can click to provide an answer, and then we're going to see what everybody ate today.
Right, so it looks like about half of us had some cereal, baked goods, or bread for breakfast. About a quarter of people had eggs, a quarter of people had fruit, 13% had nothing. So Dr. Lee, tell us what this all means.
So I don't know if anyone's ever been accused of being hangry, or if you've met someone in your life who you know you should have food ready, just because if they skip a meal, their energy just drops and people become really tired and cranky. We definitely have some of these folks in our family, and it just proves the point that having breakfast is really important. When your parents told you that breakfast was the most important meal of the day, they were right. There are actually studies that show that kids perform and behave better at school when they eat breakfast. I think that was a big impetus towards school food and making sure that New York City kids have breakfast for everyone available. Eating breakfast also helps us avoid cravings, and so we might make better food choices. Not sure if you've heard advice about going to the grocery store hungry versus eating before you go to the store. When you're really hungry, you're more likely to reach for that package of Oreos. And breakfasts are not all equal. So make sure that we're having a balanced breakfast, so coffee and a donut doesn't really count. All right, so let's move to the next slide. And so how does our mood affect our food choice? So there's some science behind this. In 1999, Macht et al. Surveyed participants, about 210 people, about their eating patterns and their moods. And what they found is that when people were experiencing emotions of anger and joy, their appetite increased. So when folks were angry, the participants said that they turned more towards comfort foods or impulse eating, and when people were very happy, they ate for pleasure. That's different than fear and sadness as emotions, where they didn't really notice a difference in what kind of eating, but they did report that people didn't feel as hungry. You are what you eat. We hear that all the time, but are we what we eat? So what we eat affects our moods, our bodies, and our health. And the point that I wanted to mention about this slide is a lot of this is bidirectional. Things go both ways. And stress can cause differences in how we feel and how we eat. So can our moods. So can communications between our gut and our brain and neurotransmitters. But all of this, the food choices that we make have an impact on all of these different areas of our life. So let's go into some particular foods, and we'll see if anyone has experienced these feelings as well. So for chocolate, many people report that it increases pleasant feelings and might reduce tension, and it actually, there's something about the feeling of eating chocolate that stimulates more cravings. When you have a Hershey's Kiss, it's really hard just to have one. On the flip side, eating chocolate could actually send some really guilty and negative feelings for those, especially if you're on a diet. So there, this can work both ways. Caffeine. So I didn't put on the slide to ask if anybody had coffee this morning. Many may have. You may know caffeine to be a stimulant, so it may make you jittery or nervous or cause mood swings. Caffeine, not drinking your coffee in the morning, if you do that every day, can actually give you withdrawal symptoms as well. Interestingly, caffeine, for those of you who are athletes or kind of use supplemental drinks or Clif bars, Clif shots, things like that, caffeine is actually found to enhance physical and mental performance. So a lot of those energy supplements have caffeine in them. And we use caffeine to treat headaches and fatigue and drowsiness. Green tea is something that's very commonly used now. It's an antioxidant, has been shown to combat depression, and some may have been told to have a glass of milk before you go to bed, and I think that's because it's found to be calming and stress reducing and generally improve mood. Omega-3 fatty acids are found in fish like salmon and sardines and mackerel, and also nuts. The impact of omega-3 fatty acids, people say that it helps memory and moods, and actually their low levels are associated with depression, pessimism, and impulsivity. So they did a study and looked at depression rates in Japan and found that there was a correlation between more fish intake and lower levels of depression. It's also used in taking care of folks with major depression, bipolar disorder, and ADHD. And we can't forget our essential vitamins and minerals. Lots of people ask me if they should take a vitamin. We actually believe in lots of colors on your plate, and if you're getting it through your diet, you don't really need supplements. Things to look out for, certainly iron. Low iron levels can cause fatigue or low energy or inattention. Thiamine has been found to cause lower self-confidence and poor moods. And folic acid is really important in fetal development. So folic acid is a part of your prenatal vitamin. It also has been found that folks suffering from depression may have lower levels of folic acid. Okay, so let's think about eating mindfully. So food can affect our moods. I don't know how many of you remember the Folgers commercials of the 1980s, but there's a jingle that I won't sing to you right now. But ultimately, it was talking about how Folgers wakes you up, that the smell of coffee itself can be uplifting and increase alertness, even if it's decaf. So this idea that a certain kind of food evokes certain emotions. Or maybe it's your grandma's famous mac and cheese, and that might bring back positive memories of sitting in a warm kitchen, sharing food with your family. Or birthday cakes. So how can we ever celebrate without a birthday cake? Our children actually look forward to birthdays, and they have a special birthday cake book with all sorts of different shapes and creations, and they pick one for their birthday, and that's what makes it a special occasion. But all of these different foods may affect how we feel and how we think about them. So here's another poll everywhere. What do you eat when you're stressed? So it's 12:40 and you just finished your 11:30 meeting and you are 10 minutes late. You're scheduled for a 1 p.m. meeting and just got a text from your child's school that after school is canceled. Because those of you who are in New York City public schools, that never happens, right? So you didn't have time for breakfast because your 8-year-old had a minor meltdown over what she was going to wear for picture day. So what are you going to eat? Go over to a poll everywhere.
All right, so tell us, what do you eat when you're stressed? All right, so it looks like about half of us, 50%, turn to sweets, myself included. But a lot of us also turn to those comfort foods, of our childhood, things like that, salty snacks. And interestingly, 14% of people said that they don't tend to eat when they're stressed. So yeah, you can tell it runs the gamut.
Yeah. So that's really interesting. So if you're working at Kings County, this is the view from outside of the ambulatory care building. These are your choices. So we have Dunkin' Donuts, Sparrow, another pizza place, Burgerway, Subway, Popeyes, and what I couldn't fit into the picture was a Carl's Jr. So, what's around us certainly has an impact on what we're able to grab, and our feelings as we're entering these restaurants can make a difference in terms of what we choose. So what could you do if you're really stressed, you haven't had time to eat, you're looking outside and this is what you see? So we're going to take a break and have a mindfulness break. This is something that we use with our patients here at Kings County because many of our patients come in with elevated blood pressures, trouble managing their blood sugars, and when we talk to them, they're under a lot of stress. It's stress from life, trying to make payments on bills, trying to look for jobs. And so, there isn't an easy solution to any of these problems, but kind of how we deal with them might be a first start. So I'm going to ask everybody to kind of sit down by your computers and put your feet firmly against the ground. Take one hand and put it on your chest and place the other one above your belly button. I'm going to have you close your eyes and breathe in slowly for a count of 4. And when you're breathing in, you're going to make your belly as big as it can be and relax your body. We're going to hold that and then breathe out for 4. So let's try that together. So let's close our eyes, take a deep breath in, make the belly go out, expand those lungs, and then let's let our breath out slowly through our mouth. And just to feel your muscles become looser and let your belly get smaller. And again, just to close your eyes, deep breath in for 1, 2, 3, 4, and then to let it out through your nose, 1, 2, 3, 4. So I hope that some of you might be willing to try this. It's something that's been helpful to my patients and certainly for us. Interestingly, there's a lot of mindfulness being taught in the school system right now. Our kids are getting lots of work, lots of testing, lots of stress, and their teachers are trying to help them deal with it and become more mindful. Okay, so when you go into LaGuardia Shackburger and you see this board, then take your deep breaths and see if that affects your choices. So what should your plate look like? These are some different tips to try to deal with food and mindfulness. Overall, the Healthy Eating My Plate is designed to have half the plate with fruits and vegetables, a quarter of the plate is for whole grains, and a quarter is for healthy protein. And so we talk to our patients about this all the time. I don't know if any of you have ever tried to do this. It is really hard. It's hard to keep half that plate fruits and vegetables. It's expensive, it's time consuming, and it's really easy to load your plate with a bunch of rice or a bunch of pasta and chicken or other kinds of meat and then have some vegetables on the side. And this plate is really trying to shift that paradigm. You'll also notice that using healthy oils in small portions is on this healthy eating plate, as well as lots of water. And anything that just doesn't have sugar. So if you want to make, cold tea and just put a tea bag in water in the fridge, that's a great way to change it up a little bit, but really avoiding sugary drinks. We also talk a lot in our pediatric clinic about having at least 3 colors on your plate, and white doesn't count. So it can't be, potatoes and corn, and it also can't be Lucky Charms and Cocoa Puffs as your colors. So this is the challenge that's been put out by the Office of Workplace Wellness, the 5-A-Day Your Way Challenge, which is taking place right now, and anybody who's interested can still join. If you join this challenge, you receive some daily tips and tools, and also a tracking tool to help you monitor your progress, and people can join the Slack online community to exchange ideas and recipes and support one another towards this journey. When we talk about healthy eating, we don't recommend completely giving up different foods. If there's something that somebody really loves, they can have it, but it's all about portions. And so I found this kind of helpful in terms of estimating portions, because we don't all carry measuring cups around with us. But in general, a cup size is the size of your fist. A half a cup might be what fits in your hand. The palm of your hand would be 3 ounces. I talk about using a deck of cards to estimate 1 serving of lean meat. You can use your thumb to estimate what a tablespoon would be, especially if you're looking at salad dressing, peanut butter, things like that. And then looking at your hand to say, what should that piece of bread be like? Because many of us may have had a piece of pita or roti or a piece of pizza that's much bigger than our hand. So what do we do at work? A lot of us don't have a refrigerator nearby. We are sitting down, working hard, and don't want to go outside to Subway or to Carl's Jr. or Sparrow to go get a snack. What can we bring with us? Air popped popcorn works great for a salty break. Using carrots if you like something crunchy, You can boil a bunch of hard-boiled eggs at the beginning of the week and bring one to work, or a cheese stick, low-fat yogurt. Fruit is always a great go-to if you're craving something sweet. And again, really to look at portion sizes. So when you're buying your containers, to put things into snack size containers. So if you're going to have a little container of something, you can control how much you're going to eat. A big bag of Doritos goes down pretty quickly, but if you have a small bag, it's going to keep moderating what you're putting into your body. New York City water has been said to be some of the best water that's out there. We actually pump 1 billion gallons of water per day from the Catskills. So try trading out sweetened beverages with water. Drink before you eat. People ask me how much they should drink. I usually say 2 liters a day. And you know what I learned on a lot of hiking and backpacking trips is your urine is supposed to be clear and copious. And that's how you know that you're well hydrated. So save plastic and paper, bring your water bottle to work, and drink tap water. You don't have to buy bottled water. So talking about workplace wellness, here's a cartoon that I thought was appropriate for today's talk. So from Dilbert, that we're launching a health and wellness initiative for employees this week. But in other news, we have cake in the break room to celebrate all of this month's birthdays. Because cake is healthy, well, we have to learn how to compartmentalize. And I feel like this is one of those challenges at work, at least in Kings County. We love to celebrate things here. And cake runs abundant, especially around 3 p.m. And it's often really hard to kind of moderate having that small piece, especially when you just really need something to grab because you're so hungry, or you just need a little sugar surge. So pack that piece of fruit and go celebrate with everybody with your apple. Other resources for city employees, so there's WW, which is formerly known as Weight Watchers. This is a picture of some of the members of our Kings County WW team. Weight Watchers, they've really rebranded themselves. There's a new program, some of you may be familiar with it. I know my mom, who's a retired school teacher, had done this off and on for many years with her friends. And it looks different now. It's called, they have a freestyle program, and it's really focusing on making long-term changes and balancing food intake, not restricting them. So our coach talks all the time about how foods are not good or bad, but it's really kind of balancing out. If you are going to have that piece of cake at work for the birthday celebration, then we're going to cut back on what we might take for dessert after dinner. They have a whole list of 0 points foods, which don't mean 0 calories, but are foods that they want people to reach for. So hard-boiled eggs, tuna fish without mayonnaise, fruits and vegetables, things like that. So it's not a program where people should feel like they're starving. You get points for each day and extra bonus points for the week. And anything that you buy that's processed or store-bought always costs you more points than something that you make at home. So it's really trying to get people to make decisions and plan their meals, cook at home, and also be physically fit. Before, another program we wanted to point out was the diabetes prevention program. Diabetes is the 4th leading cause of death in New York City, and it's something that really, when somebody comes to a primary care doctor's office with diabetes, we've missed an opportunity to prevent it. So this program focuses on adults with pre-diabetes who are obese or overweight, and it teaches folks who are really committed to working with a group over the course of a year to make small but impactful changes to food intake, to reach weight loss and physical activity goals, and to really learn some self-monitoring of food intake, physical activity, and stress. This has been a really successful program nationwide. In fact, new diabetes diagnoses decreased by 58% for people who participated in this program. And the Office of Workplace Wellness is helping to launch diabetes prevention programs in the workplace in New York City. So Kings County will be launching a DPP in our wellness center this spring. Self-management, so kind of being accountable for what you're eating. Food diaries, I'm not sure if any of you have tried this before. There are the traditional paper models. There are lots of free apps you can put on your phone. Some of them just track calories and what you're eating. Some of them also track your activity or moods, physical symptoms. So if you notice any patterns that are associated with the foods that you're eating, this is something to talk to your healthcare provider about because it may have an impact on your health. So take-home tips, a well-balanced diet is always best. Strive for something that's rich in protein, low in fat, has some carbohydrates, lots of vitamins and minerals. Enjoy your pleasurable foods, but just watch the portions. Enjoy them in small amounts and try to avoid them when you're hungry. Try keeping a food diary, pack your lunch, drink lots of water, and listen to your body. Some advise eating until you're 80% full. Another book I was reading about running suggested that in Japan, people are, the runners are very lean and fit and eat with chopsticks, and that might limit your intake. We've noticed people can eat lots with chopsticks too, but just an idea. Anything you can do to try to look at your portion sizes. And so I think that's it for my slides. Thank you for attending today. I'm going to pass it back over to Marissa.
Right. Thank you so much, Melissa. That was wonderful. So much great information. We do have some time for questions. So if you have questions, you can type them in to the question box in the corner of your screen. And as you're typing in your questions, just want to say, we really value your feedback as we work to create webinars and other programs that are helpful and relevant to you. So there's a link on your screen right now. We will circulate it via email as well, and we would just really appreciate it if you could take a few minutes to tell us whether you enjoyed the presentation. And so in terms of questions, let's see. Dr. Lee, what are your thoughts on the keto diet?
So, what we usually talk about in primary care, again, is really to emphasize balance. I know that different diets have been used to treat certain medical problems, some, folks with intractable seizures, et cetera, and so there may be special case scenarios, but I encourage my patients to focus on a more broad balance perspective instead of one specific way of eating.
Great. And another question that came in, someone was asking about brown rice. Again, I think like the keto diet, people are asking about the paleo diet and just what your thoughts are on if brown rice is a healthy food to eat.
So I'll be honest about brown rice. I grew up eating white rice exclusively. And when my husband came home with a bag of brown rice, I kind of poo-pooed it and said, I'm not going to eat that. But it's actually pretty tasty. And I think that the idea behind the paleo diet, behind any of these raw food diets, is really that the natural way to eat foods is to eat them intact. And the white rice is processed. And so if we're removing shells and fiber, then we're not getting the full nutritional value out of our food. More processed foods are actually easier to digest, so they come kind of right through our system, and we're really not getting the most bang for our buck out of them. So if you enjoy eating brown rice, definitely go for it.
Great. Someone asked, how do you know when you're 80% full? Are there any physical or mental cues that we can look for?
I don't know if you've ever had the sensation where I could have some more, and then once you eat more, then you realize that you've gone too far. So I think it's really realizing, okay, I've had my portion, let me rest a bit and give it a chance to sink in and see if I'm really still hungry. And drinking water helps with that as well. So I think it's really cueing into your body's sensations. If you're really hungry, you're going to know that. But trying to make sure that we don't overdo it. And often, I struggle with this all the time, trying to stop before it's kind of too late and I'm uncomfortable.
Great. I think we've probably all been there. What about, are there certain foods that are associated with inflammation that you recommend people avoid?
This one's a tougher one. I'm not really sure. Inflammation can happen in different medical processes in terms of the joints, in our gut, etc. I don't know if there are certain foods that you would avoid specifically, but we can look into that and try to get more resources for you if you need them.
That'd be great. And I think it just speaks to, you know, the paradigm is say everything in moderation. Someone is asking, in terms of, you know, the hand measurement was, they said was very helpful for physical food, but is there something that they can use as a cue for fluids, like how much is one serving of juice or something, for example?
So I would say swap out your juice for water. And your water, you know, I walk around all day long with an Nalgene bottle, which, you know, these are like indestructible, so that's why they work well for me, but they actually have fluid ounces on them, so I can see, you know, how much I'm drinking throughout the day. Juice, you know, I'll usually tell people if you really want apple juice, eat the apple, because the juice is a more processed version of that. Our dentist says if you need to put some juice, then you should only put enough juice to color the water. And so if you need a little flavor, you can do that, but it should really be minimal.
Great. Someone asked, can you eat too many vegetables?
I don't think so. You could overdo the 5-a-day challenge and go for 10. I mean, anything that you eat is going to affect your, you know, how your body is processing food. So your gut is going to respond to whatever you put into it. But I think, you know, if you think back to people as hunters and gatherers, they had lots more fiber than we do right now, and they were pretty fit.
It's a really good point. A lot of people are asking about intermittent fasting. I'm not sure if there's anything medically about that, if you can share any thoughts about whether that's a good paradigm to use.
Yeah, so it's interesting. So I think there are different communities. I mean, some people do intermittent fasting for religious reasons. Others do them as cleansings. I know athletes who swear by it. But, you know, honestly, it's that balance that I think is so important. And I worry about having these fluctuations. I don't know how others do when they're very hungry, but often you'll reach for foods that you might not have reached for at other times. And really, if you're putting in healthy, natural foods into your body throughout the day in the right amounts, I think that's really the balance that we advise for our patients in terms of prevention and healthcare maintenance.
Great. Someone, we're getting lots of questions. This is great. So try to get to as many of them as we can, and then, you know, whatever we can, we will follow up individually. So rest assured, we see all the questions coming in. But let me ask you, Dr. Lee, about the benefits of flaxseed. Is that something that has positive benefits for your body?
Yeah, I mean, I think flaxseed's been talked about just in terms of omega-3 fatty acids, so some of those benefits, and also there's a lot of fiber in there. So if you're blending up your smoothie, adding some flaxseed, or if you're baking, adding some flaxseed, and they sell it in all different forms now, so I think it's actually even easier to use.
Great. Someone else is asking about, you know, that the news that processed meats are linked to cancer. And so they're asking if deli turkey is considered processed or if it's something that they can have as part of a regular diet, you know, generally.
I think it's a really good question. It's interesting because, you know, just looking at the WW foods, you can have deli meat and it's low points because it's considered a low high protein, low fat food. Something I'd point out, so the links, you know, there are lots of studies out there, and you have to look at kind of the study size and the kinds of foods that they put into them. I don't know if those particular studies looked at turkey versus if they were just looking at red meat, so I don't know that data. One thing to think about with deli meats though is there's a ton of salt in them, and because they're processed. So in general, anything that's processed or preserved is going to have a lot of salt and have an impact that way as well. So the general, again, portion sizes and kind of having, limiting what you're having, and then just having as much control. If you're cooking at home, you're going to have more control over what goes into your food than buying it from the deli counter.
Great. Are there any foods that you recommend to help with bloating?
So many of our patients will mention that they notice a link between certain types of foods and bloating. And some of it is individual, some of it may represent enzyme deficiencies. For example, some folks who have a lot of dairy or have some dairy in their diet, hiding in different places, whether it's yogurt, ice cream, cheeses, have difficulty digesting some of the sugars in that food. And so they may develop bloating. So some of my patients try Lactaid or try to cut back on their intake and definitely notice a difference. Food diaries are great for this because if you're tracking what you're eating and then also taking note of your symptoms, you find those correlations and talk to your PCP about them, that may be a treatment for your symptoms. Other foods that are often associated with just abdominal symptoms, are foods that cause more gas. So that's your beans and legumes and things like that.
Great. What are your thoughts? Sorry, lots of questions for you coming in. Someone said, you mentioned to cut the sugar. What about honey? What about, some of the artificial sweeteners out there? Are any of those good alternatives?
So I think in general, any kind of natural sweetener is always going to be better than something that's chemical. Do I have patients who use stevia or Sweet and Low or Equal? Absolutely. Given the choice, I'd rather that they do that instead of sugar because that's not going to have an impact on their blood sugars. But a lot of these are pretty processed. So you have to decide what you're going to do. Honey is easy to eat. There's a lot of sugar in honey. So it just really depends. Are you using this because you want to try to have a more natural diet? Or if you're using this to try to decrease your sugar intake, it probably won't have the same effect that you're looking for.
Great. Someone asked, if they're looking to read more about healthy eating and how food affects mood, are there any books or resources that you recommend to your patients?
So Marissa, maybe we can put out some or share some resources at the end. Would that work?
Definitely. Mm-hmm. Yeah, definitely. And we'll wrap up with one or two more. A lot of people are asking about ideas for healthy snacks, especially at work. I know you gave us some suggestions. But do you have any suggestions for people who get tired of eating the same snacks or same types of food every day, how to mix it up?
It's so hard because I think, ideally we could have a varied diet every day, but I'm sure that all of us are working as city employees and, time is short. And so I've eaten a lot of hard-boiled eggs because kind of making things in batches is helpful for us. But also when you're buying things from the store to consider, my kids love frozen fruit. So if we find blueberries, then we wash and freeze a whole batch of them and they can take a serving of frozen fruit, which tastes like candy. Frozen bananas are delicious. So, there are different things that you can do. If you can do it in bulk and have enough room in your fridge to kind of hold that so you can shake it up a little, I do agree it's going to be a lot more entertaining because sometimes just reaching for that food that you shouldn't have is something that is hard to avoid. But cut up pieces of fruits and vegetables and, small amounts of dips. Small amounts of hummus, or if you're going to make that on your own and make that with chickpeas and, lesser amounts of oil than store-bought foods, like those are all great options too. It's all about portions.
Yeah, sounds like planning and just trying, experimenting with new things is the way to go. And I'll put in another plug for our 5-a-day challenge. You know, lots of people are sharing what they're snacking on during the day and what they're eating for different meals. So I've found it's a great way to get some tips. But thank you, Dr. Lee, so much for your time and for this great presentation. We will try to follow up with some answers to specific questions that we didn't get to cover today. We will also be sending out the webinar recording and the slides for everyone's reference. And thank you so much for joining us, and we hope you have a mindful and healthy rest of your Wednesday.
Thanks so much, Marissa. Take care, everyone.